Senator Omidvar.
Thank you, Speaker. Colleagues, I rise today to speak to Bill C-31, an act respecting cost of living relief measures related to dental care and rental housing. I support this bill in principle, and today I will focus my remarks on the dental benefit portion of the bill. I wish to congratulate my colleagues, Senators Youssef and Senator Seidman, for their excellent speeches. For my part, all this talk about dentists and kids takes me back to my own childhood of being dragged to a dentist. I was very traumatized. I have a vague memory of lots of persuasion being at play, and I think hard candy was involved. But I have my own teeth today, all of them, gratefully, and I'm very, very grateful that my parents had the means to insist on this essential care. It's not the same for all Canadians, and I speak from a bit of first-hand experience. In 2016, just 8 years ago, a Syrian refugee family with 8 children under the ages of 15 landed in Toronto. As their sponsor, the first 3 months were completely hectic for them and for us. We soon discovered a challenge that we had not prepared for: the oral health of the 8 children. Their teeth were in terrible shape. They were rotten, frankly, because there were apparently rivers of hard candy running through the camps as opposed to healthy food. Even to our untrained eyes, we could see that there was a problem. However, although the federal government picks up the costs of health care for refugees in the first year of arrival, this coverage does not extend to routine dental care, only to emergency dental care. In other words, the family would have needed to wait for a dental emergency to get the care they needed, or until they qualified for the Healthy Smiles program, which was a year. Left up to our own resources, the sponsoring team, we dug into our pockets and we relied on the goodwill of many volunteer dentists. Oral health for children, we have heard today, is very important. Let me quote some further facts for you. According to the 2010 Canadian Health Measures Survey, well over 50% of 6 to 19-year-olds have or had at least one cavity and have, on average, 2.5 teeth affected by tooth decay. Bad oral health is the most common chronic disease in children, 5 times more prevalent than asthma. Poor oral health also increases gum disease, has been linked to cancer, as Senator Youssef has pointed out, Alzheimer's, diabetes, and heart disease. A study has shown that across the OECD, 5% of total health expenditures originate from treatment of oral diseases. Direct treatment costs due to dental diseases worldwide have been estimated at $298 billion annually, corresponding to an average of 6% of global health expenditures. So having good oral health is good for the kids, it's good for our healthcare system, it's certainly good for the economy. Colleagues, I know that the questions today and the debate today we have talked about concerns that this bill moves into provincial jurisdiction. We know that provinces and territories in Canada have pre-existing dental care programs for children. But according to the Canadian Dental Association, while several of these programs have a solid infrastructure in place, others are currently underfunded, and as a result do not respond to the individual oral health needs of pediatric patients. They noted that PEI does oral health fairly well, whereas in my province of Ontario, the outcomes don't seem to be so good. In an ideal world, I do not dispute Senator Seidman, in an ideal world, it would have been preferable to use the plumbing of existing provincial agreements, sign agreements to the provinces to bolster their own programs, to get the money faster, quicker, through existing machinery to the people. I do not dispute that. However, as we well know, such agreements are hard to negotiate. They take a very long time, Every agreement with every province and every territory is different, and inevitably we will see a patchwork of services, as we have heard from Senator Seidman. Quebec does this, Ontario does this, Newfoundland does this, etc., etc. With this initial 2-year program, the government accomplishes a number of objectives. First, it covers the whole nation regardless of where you live. It doesn't matter where you live. If you have a child 1 year to 12 years old, they will benefit from the program. It is contingent only on income levels. Second, it takes effect almost immediately, bringing much needed relief to poor people in a timely manner. And thirdly, I believe it allows the government to assess the efficacy of a 2-year initial pilot program, let me call it that, as they consider rolling out the permanent program. And whilst we are on FedProv agreement, let me clutch a bit about the province that I live in. Even when agreements are signed, there is no assurance of accountability. In Ontario, parents are still waiting for a $10 a day program, daycare program, although the agreement was signed, I don't know, maybe even a year ago. Again in Ontario, we have seen a government accrue a budget surplus of $2.1 billion when our healthcare system is in shambles. And it is the same government that is using the notwithstanding clause to deal with the labor issue. It makes sense to me that the federal government trusts families to make the right decision for their children, that given a chance, given a little extra money, the extra boost in financial confidence, they will call their dentist and make appointments for their children and use the money to bridge whatever gaps there may be in provincial programs. To those who say $650 is not enough, I would say you may well be right. Am I talking too loudly? My paper, sorry. Okay, I would say you may well be right. Thank you, Senator Cormier. That body language worked brilliantly. But the government has not dreamt this figure up out of thin air. At a pre-study at National Finance, we heard from the PBO that the average cost of dental care for children under 12, remember under 12 they still have milk teeth, is under $650. The same was confirmed by the Dental Association of Canada. In comparison to other jurisdictions, you may be interested in this, we are playing catch-up. We're always playing catch-up, I feel. Australia rolled out a very, very similar program in 2014. Its program functions very much the way this program is designed to function, except it extends to children up to 19 years old. Of course, the gold standard would be the National Health Service in the UK, which covers all dental costs and encourages parents to start with dental appointments as soon as milk teeth appear. We all know that this is a time-sensitive program. This interim program of 2 years will eventually develop into a more permanent program. At least that is the hope of many Canadians. It targets those in highest needs. Parents who have private dental insurance are not eligible, and those who are covered by a provincial program are only eligible to have out-of-pocket expenses compensated. Provinces and private plans will always be the first payers, and the federal dental program will come after that. At committee, we were informed by officials that there will be no clawbacks provincial governments, as this bill does not touch on or harmonize with any of theirs. I do have some concerns about the bill. Some of these have been raised by other people. But I think it doesn't matter if we raise concerns again and again. Maybe the committee will take note of them. We know that about 10% of Canadians are non-filers. How will they access this benefit? For those who are already in the system and receive the Canada Child Benefit, it's fairly simple. These individuals have a CRA My account, and they simply have to use it to apply for the new benefit. My concern, though, is for the non-filers. And this is not an insignificant amount, 10 to 12%. We were unable to determine, I don't know who these non-filers are. I know they're not low income, as studies have pointed out, but we don't know if they have children. We don't know if they are working or not. Likely they are, but they're not, filing their tax return. I do believe that it is time that the CRA address this very important question in a serious manner. In my question to the officials at the committee, I was told that they have a strategic plan called Get Ready, but they don't appear to have set any standards or benchmarks against this plan to assure the people of Canada that they're reaching non-filers and that non-filers are beginning to file. I would like to see a benchmark, an objective put in place, that after the end of their Get Ready program on evaluation, at least 3% more are filing. That would be a success. The second question is about capacity. We know that certain parts of the country, especially rural and northern communities, do not have good access to dental care. There are shortages in dentists and there are shortages in hygienists. The extra demand from the south, I hesitate to say south in the context of Canada, but I think you all know what I mean. There is a concern that supply of dental services and dental professionals may migrate to the south. And one unintended outcome could be the loss of dentists and dental hygienists from small and rural communities. The federal and provincial governments should think long and hard about using an untapped use of workers, and these are internationally trained healthcare, dental health professionals. We know that many of these internationally trained professionals come here through the Express Entry program, which favors people whose skills are badly needed. However, when they arrive, they get in what I call credentialism hell, which takes a great deal of time and a huge amount of resources to pull yourself out of. This is a national problem, which is complicated by the fact that regulated occupations, such as dentistry, are under the jurisdiction of provincial governments, who in turn maintain, not our business, these are self-regulating, independent occupations. We cannot force them to do anything. It is a veritable maze. However, the issue of capacity in the context of dental care in remote and rural communities could be addressed by providing a restricted license to those dentists who have passed some portion of their exams as long as they work in a restricted location. Restricted location, restricted practice. Clearly, this would have to be done province by province, but it does provide an impetus for provinces to consider this or other proposals. Perhaps the federal government could even play a role in incentivizing such behavior. This practice is followed by Australia, for example. In conclusion, colleagues, the absence of dental coverage for poor people, especially children, is a blemish on Canada's avowed aspiration to be a nation of inclusion and opportunity. This bill takes the first, small but very important step in building a healthier future for our children. Thank you.